Are these medications safe to take during this pandemic?
Yeah, I mean, I think we touched on this a little bit already. I think if whatever you're on, as far as your baseline medication, if you're stable on that medication, you should continue that, and not stop them on your own. Only if I think you have symptoms should you talk to your gastroenterologist, and then you can have a discussion what that means. So first situation, stable on medication, stay on it. You get sick, talk to your gastroenterologist. I think the audience probably wants a little bit more sort of information than that, but that's the baseline sort of recommendations. Now, if we look at individual drugs, we've sort of started to think about this as a COVID task force in Alberta. And, so mesalamine, there's no risk. And I think Laura already spoke to that. If you then start to look at prednisone, the risk for prednisone probably for worsening disease or sort of high risk, we would say would be between a dose of 20 and 40 milligrams. Sort of an intermediate risk would be between 10 and 20, and then your risk starts to get low. It starts to get very low if you're below 10 milligrams. Drugs like azathioprine probably have sort of an intermediate risk. So if you're on azathioprine or 6-mercaptopurine, we consider that an intermediate risk. Surprisingly, anti-TNF therapy, and we know this sort of from anti-TNF and sort of viral infection, anti-TNF therapy, even though we think of those as systemic immunosuppressants, probably are in a lower risk category as well. And drugs like ustekinumab or Stelara or Entyvio would be even a lower risk category than that. So that's to give you an idea of the risk of the different drugs. As far as if someone, and again, then we pivot into somebody who may get infected. And then in those situations, I think most of us are recommending if you're on one of those sort of medium to high risk drugs, meaning if you're on combination therapy with azathioprine or on azathioprine or 6-mercaptopurine alone or in combination, you would stop that drug at least while you have the infection. Anti-TNF therapy, one of the things that is difficult with that, and I got a question from a colleague in Ontario about that, is the drug is in your system for about 12 weeks when you have it, even if you stop it. Even the self-injectables have longer half-lives, Stelara. So those drugs, unless you're supposed to get the drug, then you probably don't need to do anything during that time. If you need to start a biologic during this pandemic, most of us would suggest that you should go with something that is more gut specific. So Entyvio may be a preferred drug at this point, if it's such that it'll treat your disease. One of the other things that we're seeing, though, and again, I think we'll touch on this, Gil, is we're starting to see this behavior that it sort of crosses this barrier of social distancing, where someone may be on an infusible drug, such as, say, infliximab, Remicade, Inflectra, and they're asking, well, can I go to a self-injectable like Humira? So that experiment has been done, and folks, where you take stable patients on infliximab and you switch them to a drug like Humira, and that didn't work out well for patients, meaning that even though they're the same class of drug, and you may think, well, I'm going to go to an injectable. So again, we would recommend against that.